Two medical mysteries that defied the experts.
I never thought this would happen to me. Why is my face getting bigger?
She was unrecognizable.
When Tanya Angus realizes her body is changing in ways she never imagined possible, she's forced to face a terrifying reality.
I knew in my heart that something's wrong with my body.
Tanya just goes, "Mom, I'm gonna die."
Then, when Cody Burns is blindsided by a horrifying symptom, he has no idea that within hours, he'll be in a desperate fight for his life.
Thought pretty much, yeah, I'm gonna suffocate to death.
Something was in him that was killing him.
You just can't watch a child go through this. It just tears you apart.
In the summer of 1996, life was full of exciting possibilities for 18-year-old Tanya Angus.
I was pretty much a normal kid. I had lived in Las Vegas, and I had just got my first car. It was just a magical time in my life.
My sister, as a teenager, she was so beautiful. She had long brown hair, long legs.
A few agencies wanted her to maybe go into modeling. Being 5'7", 5'8", it was the perfect height for modeling.
But Tanya isn't interested in a glamorous career. What she yearns for is a family of her own.
My plans in life were to get married, have 2 kids, a boy and a girl. That was a very important dream for me.
Life is seemingly perfect for Tanya, until one hot summer night when she's suddenly hit by an excruciating pain.
I was looking at the headlights of oncoming traffic, and my head was just pounding, like someone cut my head open and started hammering.
The pain is so intense, Tanya has no choice but to pull over. But almost as soon as she stops the car, a disturbing new symptom emerges.
I just hear crackling in my head. It sounded like crunching, and it finally, as fast as it came, it went away.
Unnerved by the experience, Tanya tells her mother, Karen, who insists she check in with their physician.
The family doctor said that it could be from stress, and it's probably just migraines. Sounds do tend to amplify in the ears with migraines, and they gave her pain medication.
Over time, Tanya learns to manage the agonizing headaches that take on a life of their own.
It was migraines about once a month.
You would see the strain on her face. And I'm like, honey, you're really hurting. She says, well, I guess, some people have one problem or another. She says, I guess I get headaches.
Then, just before celebrating her 19th birthday, something happens that makes Tanya completely forget about her health problems.
I had met a guy. It was like a connection right off the bat. We would sit there and talk all night.
During the next 6 months, the couple grows closer and closer and decides to make a life together in his home state of Michigan, 1,800 miles away.
I was in love, and I couldn't wait to leave Las Vegas. I was free as a bird. There was snow when I got there. I loved the season change. I fell in love with the atmosphere.
She seemed very happy at that point, and I accepted the fact that maybe this is where she really belonged. And I asked her about her headaches, and she says, oh, they're not too bad. They seem to be okay. I keep really busy.
Tanya is thrilled with her new life. She even finds an unlikely job as a security guard. To her surprise, it suits her.
It was like playing cat and mouse. That was fun to me.
But as the months go by, she begins to notice that her boyfriend is growing increasingly distant.
He said I was gaining weight. He wasn't very happy, and a lot of times, he would just ignore me. It hurt so bad.
Then, one fall morning, Tanya notices something truly bizarre.
I was looking at my hands. My fingers were wider and longer. My hands had grown so big that my rings were getting so tight on my hand. It was kind of scary.
Alarmed, she goes to a local clinic, but the on-call doctor can find nothing wrong.
I was like, well, that's weird.
And it's not long before another part of Tanya's body begins to mysteriously change.
My feet were just growing like crazy. I was a girl size 9. When I went to the shoe store, I had measured my feet.
She says, Mom, you and I used to wear the same shoe size. She says, I'm in an 11.
I was stunned. I mean, how on earth can this be possible? I had to buy a pair of men's shoes. My boyfriend was like, why did you buy men's shoes? I was like, because that's all I'll fit in. And he's like, you look like a guy. I said, am I still pretty to you? He goes, you've changed a lot. He didn't seem to like me anymore. When I looked in the mirror, I just saw the same old me. It wasn't any different. I just couldn't understand how all of this could happen.
Over the next month, her boyfriend grows increasingly detached, and finally, he breaks off the relationship.
I felt like my heart was being ripped out of my chest. I had always wanted to get married, and I'm kind of scared that nobody's gonna want me because people were uncomfortable with the way I looked.
To make matters worse, Tanya's body is continuing to transform in ways she never expected.
My legs were getting longer, and my arms and hands were getting longer. I started having to get bigger clothes. It would fit for maybe 2 months, and then I'd grow out of it.
Tanya thought she had stopped growing years before. Alarmed, she decides to check in with a new doctor.
She was just like, you're probably just growing. And she did the measuring tape. They're like 5 feet 11 inches.
Amazingly, Tanya has shot up 3 inches over the past year. But the doctor assures her that it's not unheard of for some girls to experience growth spurts past their teens.
How could I have grown so much? It was so bizarre.
I got a bad feeling. I can't understand this. I says, Tanya, I'm begging you, please come home. I knew something was wrong.
20-year-old Tanya Angus suffers from migraines, hears strange sounds in her head, and now her body has suddenly started to grow again. In fact, she's shot up 3 inches over the past year. But Tanya's doctors keep telling her there's nothing wrong, and she doesn't know what to believe.
This is getting too weird, but not one of my doctors ever took me seriously. I was really embarrassed by all the changes that my body was going through.
Mortified by the state her body is in, Tanya begins to wonder how much more she can take. Little does she know that the worst is yet to come.
My hands were hurting, my feet were hurting. I couldn't even explain the pain in my back. It was getting so bad. I went to another doctor and I told them all my symptoms. I go, I'm taller than I was before, I can feel it. I have these killer migraines. I said, and my back is hurting. I'm just having all over pain.
But once again, yet another doctor assures Tanya that she has no medical problem.
All the time, my doctors kept saying, there's nothing wrong with you. But I knew in my heart that something's wrong with my body.
She sounded very depressed, and my heart was breaking.
You know, my forehead's bigger, my chin, my nose, my cheekbones are farther apart. My jaw has shifted. This isn't right. I'm like, why is my face getting bigger?
Then, on a sunny day in April, while she's on duty at the department store, an incident occurs that shakes Tanya to the core.
This little girl was yanking on her mom's dress. Mommy, is that a boy or a girl? Everyone turned around and looked. Felt like I wanted to hide and I wanted to put my head in the trash bin so nobody could see me. I was absolutely mortified. I couldn't handle it anymore. I just wanted to go home where there would be people who loved me.
The very next day, Tanya flies back home to Las Vegas. But nothing could have prepared her for what happens at the airport.
When I saw my sister, she had that look on her face like, do I know you?
She was unrecognizable. She didn't look at all what she used to look like.
I was scared because she looked at me like she was afraid of me.
I was freaked out. And I said, you don't look like yourself, Tanya.
Deeply worried, Susie takes Tanya directly to Dr. Eleanor Cajita, a pediatrician and longtime family friend.
Tanya was the daughter of my best friend, Karen. I was amazed at how tall Tanya had become as a young woman in her 20s. Her facial features were very different. She had a protruding chin. Her cheeks were fuller. Her forehead was larger. Based on her physical examination and her signs and symptoms, I thought that this was a very serious condition. I had ordered some hormone tests, and also we ordered an MRI.
The next week is agonizing as the family waits for the findings to come in.
You cannot describe the weight. It hurts mentally and physically. Your mind is going millions of miles a minute.
Finally, the results are back. The level of the hormone that controls growth is off the charts.
My heart sank because I already knew what she had. She had a pituitary tumor. The pituitary gland is a very small gland that sits at the base of our brain. Tanya's tumor was almost the size of an orange. I diagnosed Tanya with acromegaly.
Acromegaly is an extremely rare disorder that causes excessive growth, or gigantism. In a healthy individual, the pituitary gland regulates growth. But in patients like Tanya, for some unknown reason, a non-cancerous tumor forms on the gland, causing it to secrete growth hormones constantly. As a result, the body never stops growing.
Nobody wants to be the bearer of bad news. This was particularly heart-wrenching for me because I knew this family personally, and Tanya was a very good friend of mine.
I was terrified that there was a giant tumor in my head.
I was in utter shock. How could she have a brain tumor? My heart just broke.
While it's unclear why the disease set in when it did, Dr. Kahita is confident that the migraines were a direct result of the growth on her pituitary gland.
The tumor is impinging on other structures in the brain, and that's probably the cause of her headaches.
And as the tumor grew, it pressed on the surrounding auditory nerves, causing the mysterious crunching sounds that Tanya heard. Eventually, the tumor got so big, it caused the pituitary gland to malfunction completely. As a result, it continuously secreted growth hormones.
Your bones, your tissues and cartilage and tendons keep on growing because the growth hormone is dictating to those organs and cells to keep on growing.
I was scared. I used to have this nightmare that I would grow taller than the Eiffel Tower.
As the family begins to finally understand Tanya's condition, they must face another harsh reality.
I think the worst case scenario for Tanya would ultimately be death because of the enlarged pituitary that would impinge on the cerebellum, which controls breathing. She would go into cardiorespiratory arrest.
She could die at any moment. You just can't, you don't want to think about that.
Dr. Kahita assures the family that surgery may help reduce some of Tanya's symptoms.
Dr. Kahita said that they'll get the tumor out, they will get her on medication.
But the operation is extremely risky. The tumor is wrapped around Tanya's carotid artery, which supplies blood to her brain.
If the carotid artery is damaged, the patient would die.
It takes Dr. Kahita 2.5 months to find a neurosurgeon willing to perform the risky procedure. Finally, in July of 2002, Tanya is wheeled into surgery.
She was scared. She was petrified at the thought of surgery. He did what they call a craniotomy, where they take the top of the head and open it up. He spent over 13 hours in her brain. When the doctor came out, he says, I had never seen one that has taken over the brain so severely. Tanya's tumor is in every nook and cranny in her brain, around arteries, around nerves. It is totally impossible to remove every little piece.
Even more devastating, the remaining bits of tumor will continue to grow.
And I just looked at him like, it didn't cure her? Tanya just goes, Mom, I'm gonna die. I says, no, you're not. I promise you won't.
"22-year-old Tanya Angus is suffering from acromegaly, an extremely rare condition that causes her body to grow uncontrollably. A massive tumor on her pituitary gland triggered the terrifying transformation she's endured over the past 4 years. And now she and her mother have just learned that there is no way the medical team can remove the entire tumor or repair the damage it's done.
I was just bewildered. I was just like kicked in the face. Tanya's pituitary gland has been crushed. So it's producing an enormous amount of growth hormone saying, keep growing, keep growing. Everything on Tanya grows. Hands, feet, her heart, her lungs, all organs.
In time, the tumor will undoubtedly grow, and Tanya will need to undergo repeated surgeries to keep it from damaging parts of her brain that control her heart and lungs. Ultimately, the condition will shorten her lifespan.
It was very difficult. You wonder, are you going to be able to handle this? And it just horrific.
I never thought this would happen to me. I never thought anything like this would happen to me.
As brave as she tries to be, Tanya still struggles to accept that she will never become a wife and mother.
I'm never gonna get proposed to. I've always wanted my own baby. And knowing that I can't reproduce is like a kick in the head.
While it's difficult to accept the diagnosis, Tanya and her family are grateful to finally know what they're facing. And they can't help but wonder why so many doctors fail to identify the critical clues.
There's a myriad of symptoms that occurs with acromegaly. Some of them are very vague. It might be difficult for any physician to diagnose Tanya had they not been familiar with her before she had signs and symptoms. It's a rare condition. We don't generally see it.
I think if she had been diagnosed earlier, that we could have caught it and maybe controlled it.
Today, 10 years after her diagnosis, Tanya lives with her sister Susie. Despite her determination to have a normal life, Tanya is constantly reminded that her body is continually changing.
When I look in the mirror today, I see a frightened little girl who grew up into a giant.
Tanya is 6'11". She weighs 371 pounds. You walk in and everybody looks at Tanya.
The staring and whispering is a little rough to take. It's become a part of my life, and I'm kind of used to it now, but it's uncomfortable. People need to realize there's a person sitting in this chair.
Fortunately for Tanya, those closest to her are able to see beyond her outward appearance.
I'm a very proud mother. She's very, very determined to be normal as possible. She loves life, and she's not going to give up.
Tanya's been an amazing patient. She has gone through so much. She has a perseverance.
I don't want anybody to go through anything that I've gone through. I'm putting this out because I'm hoping that I'm helping people.
Remarkably, Tanya has learned to stay optimistic in the face of truly frightening odds.
She's fighting tooth and nail, and she wants to live.
I'm gonna be here as long as I can. I intend to stick around for a long time.
Next, from the time Cody Burns was an infant, doctors believed they had a handle on his health. That is, until his life was suddenly on the line. In the summer of 1991, 19-year-old Shelley Dinkins married her high school sweetheart. And within months, she was eagerly awaiting the birth of her first child.
I can't remember a time in my life that I didn't want to be a mom.
I was excited. I was hoping it was going to be a boy.
Talked to him all day and rubbed my tummy, and every day I loved him more and more.
Finally, after a healthy and trouble-free pregnancy, Shelley goes into labor.
I just kept thinking, oh my gosh, I can't believe this is happening. And there was my beautiful boy.
He looked just like his grandpa. My heart swelled up big enough to burst in my chest.
But while motherhood is a joyful experience for Shelley, the challenge of being young first-time parents takes a toll on the marriage.
When Cody was 8 months old, his father and I had parted ways, and that was pretty heartbreaking, pretty devastating. All of a sudden, I had to get a job with the school district. My mom and dad took over that role of watching Cody for me.
I felt it was important for him to have a man around and be a role model for him. And I loved him with all my heart. He was just the funniest little kid. He was just so happy.
I remember my grandpa the most. When I was a kid, he was like my sidekick. He was very supportive. My grandpa's been through everything with me pretty much.
Over the next year, Cody thrives and is rarely sick. Nothing could have prepared Shelley for what happens one spring evening in 1994.
Cody was just shy of turning 2, and I had tucked him in bed for the night. Probably within a half an hour, I hear him coming down the hall, and I just hear gasping for air. He was bright red. His cheeks were red. His lips were blue. He kept coughing. It's like this horrific barking cough.
He's just this little bitty little guy. I could tell that he wasn't breathing good, and it just sent a chill down my spine.
So I take him straight to the emergency room. When we arrived at the ER, the doctors started frantically looking at him. They didn't think he was gonna live because his coloring was blue and he couldn't breathe. I was petrified.
Shelley Dinkins has rushed her 21-month-old son Cody to the ER after finding him coughing violently and gasping for air. Now, the infant's oxygen levels are dangerously low. In a race against time, doctors work frantically to help him breathe.
The breathing was so shallow. It was scary. It was really scary. They had put a mask over him. It was like a mist that he was breathing in.
Once they did that, his chest opened up and he was able to breathe fairly normally.
They sent him over to a pediatric pulmonologist who ran tests on him and deemed him to be asthmatic. The one thing the doctors told us is that he's very young. He could very well outgrow it. And on the other hand, it could get much worse. I was scared.
When I was a kid, sometimes I wouldn't know if I could catch my breath, and that would just kind of scare me a little bit.
Unfortunately, Cody's asthma is already very severe. He'll need to take medication several times a day to keep it under control. Shelley will be able to administer it through a nebulizer. Essentially, the device turns a liquid treatment into a mist, which is inhaled into the lungs. But the nebulizer only helps so much.
I would take my breathing treatments almost every day, and it would open up my breathing a little bit, but not that noticeable.
He was constantly getting sick. Every few hours, he had to take a breathing treatment, and I had to be religious about it.
Despite her vigilance, Shelley lives in fear of another serious attack. And by the time Cody enters elementary school, his constant cough and shortness of breath set him apart from the other children.
I've always been not the same as any other kid, not able to do everything. I would try as hard as I could, but I would find myself getting winded a lot quicker than the other kids.
And as the years go by, the difference becomes even more pronounced.
He tried out for basketball, and he was really good at it, but he just physically couldn't get through a whole game.
I got frustrated a lot. I wanted to do better all the time, and it would upset me.
As a parent, your heart's breaking a little more and more each time.
Then, just when Shelley begins wondering how much more she can take, the asthma attacks all but disappear soon after Cody celebrates his 12th birthday.
We all thought that, oh my gosh, he beat it. We thought he'd outgrown it, and he wasn't having any more breathing treatments.
I could breathe a lot better. I was feeling pretty much the best I had ever felt. I pretty much did everything normal.
In high school, he actually tried out for the track team.
I liked running a lot at the time. I had a lot of good friends that were in there, and so I really wanted to get into it.
He was in a sport, and he was doing it, and he loved it.
Shelley is thrilled to see her son transform. Cody is no longer the shy, frail little boy he once was. It's all too clear when he works up the courage to ask Serena Grosjean on a date.
I just kind of got a hint that he might have had a little crush on me.
He'd been in love with Serena since like 8th grade.
We started dating junior year. We started to walk together more, and that was like our special time together before and after school.
But one morning in the fall of 2008, Cody is blindsided by an all-too-familiar symptom.
I was coughing like crazy, almost unstoppable. I felt like I was struggling for breath, or there was something stuck in my throat or my lungs.
He was just very tired, more out of breath, sweating. Something bad was going on. It was just very scary.
In a state of panic, Cody immediately gets in touch with his mother.
It was really, really out of the norm for Cody to call me at all during the day. And I knew for him to call me and actually tell me he's sick, I knew there's something so wrong with my child.
Terrified, Shelley races over to her son. Within 10 minutes, they're in the family physician's office.
When they listened to his lungs, they could hear crackling. The doctor said, oh, his asthma's back. And here we were right back to square one, where we thought he was gonna be normal and had outgrown it. I remember finally just being like, are you kidding me right now? Can you give the kid a break?
I stopped running. I was pretty sad that I couldn't do all the things that I had wanted to do, and I felt a little left out.
Cody has scarcely adjusted to giving up the sport he loves when a horrifying new symptom suddenly emerges.
Cody was playing a video game in the game room, and he kept doing the tickle cough, coughing. Then he got up, went in the bathroom.
I coughed up what looked like a little raspberry. I had no idea what it was, and then I started coughing up blood.
I hear him say, Mom, come here. And in the toilet is so much blood. Unbelievable amount of blood with these white, looked like white raspberries. And in that moment, I knew this is not asthma. Deep, deep down in my gut, I knew something was horrifically wrong.
After 16-year-old Cody Burns starts coughing up blood and bits of strange white tissue, his mother rushes him to Lucille Packard Children's Hospital. Now, Cody is struggling desperately to breathe. Doctors immediately prep him for a bronchoscopy, a procedure in which a tiny camera is inserted down the windpipe.
They took him in this room, and they started to put him under, and the doctor asked me to step outside. And within minutes, this will be in my brain for an eternity, I heard the doctor say, go get the mother.
The doctor came immediately out of the room, and she says, he's only got 30% airway.
The doctor handed me these pictures of my son's trachea.
It looked like raspberries covered in my entire windpipe. You couldn't even see down my windpipe at all. It freaked me out.
You just can't watch a child go through this. It just tears you apart. Your heart just hurts.
The doctors were afraid that at any moment he could suffocate. No one knew anything about what was wrong.
I thought pretty much, yeah, I'm gonna suffocate to death, and I was definitely scared.
I'm not gonna let you die. You're not gonna die. I'm not gonna let you die.
Utterly baffled by the bizarre growths, Cody's medical team calls in ear, nose, and throat surgeon, Dr. Peter Koltai.
There were growths all along the entire length of the trachea, so that there was limited space for air exchange. It was quite obvious that they were obstructing it.
I was really, really, really afraid that my son was dying. Something was in him that was killing him.
I can't explain the feeling. What is this, cancer? What is this?
Dr. Koltai immediately scheduled surgery for Cody.
There was no other option. We basically needed to clean out his trachea and open up his airway.
I was definitely scared. I had no idea what was in my throat.
I'm panicked. I was scared because I didn't know what this was and what caused it and what it was going to become.
As Cody is wheeled into the OR, Shelley and Bill begin counting down the hours.
The time he was in surgery was probably the longest time I spent in my life. I mean, waiting and wanting to hear good news.
I was such a wreck. It was horrible.
In a grueling 3-hour procedure, Dr. Koltai uses a laser to vaporize the growths one by one.
I'd say probably we removed 70% of the lesions. There were some real small ones, the size of a pea, to one that was as large as the digit of my thumb.
And when Cody wakes up, he is in agony. His throat literally scraped raw.
It was probably the worst pain I'd ever been in my life.
Never, as long as I live,
Do I ever want to see my child in that kind of pain?
But Dr. Koltai still can't be sure what the odd raspberry-like growths are. And until the lab results come back, the family can only wait.
And for me, it was the most miserable time on the face of the earth. I just kept praying and praying, God, don't let this be something. God, don't let this be something serious.
Finally, the results of the lab tests are in.
The definitive diagnosis of Cody came after tissue was examined under a microscope and confirmed to be recurrent respiratory papillomatosis.
Recurrent respiratory papillomatosis, or RRP, is an extremely rare disease caused by the human papillomavirus. Normally, the virus, also known as HPV, causes cells to reproduce wildly, resulting in wart-like growths in the female genital area. But in some very unusual cases, the virus can attack the mucous membranes in the respiratory tract.
The majority of children usually present with papilloma primarily in the voice box. With Cody, most of the disease seemed to be focused in the windpipe, which was very unusual, almost unheard of.
Dr. Koltai told me this is the worst documented case he'd ever seen. That he couldn't believe my son was alive. It was horrible. And I knew there was more to come.
Just 12 hours ago, 16-year-old Cody Burns was barely able to breathe. Fearing that he might suffocate, doctors immediately performed emergency surgery to save his life. Now, he and his family have received some stunning news. Cody doesn't have asthma, as he's always been told, but a rare disease called recurrent respiratory papillomatosis.
There was no relief whatsoever, just fear.
Dr. Koltai suspects that Cody has been living with RRP since the day he was born.
We know that it seems to be acquired during birth through the maternal genital tract, through a vaginal delivery.
I was frantically trying to call my OBGYN to find out if I'd had HPV virus.
But there's no evidence that Shelley ever had the virus.
The question about whether Cody developed his papilloma as a consequence of an infection at the time of his birth, obviously speculative, and we'll never really know the answer.
However, Dr. Koltai is certain that the viral growths first started to affect Cody's breathing when he was just 2 years old, and then went into remission soon after he turned 12.
We know that papilloma will sometimes spontaneously disappear as children go into puberty. So there seems to be some hormonal influence on the growth of papilloma.
And then, just as quickly as Cody's asthma-like symptoms vanished, they reappeared 4 years later, even worse than before.
His windpipe is filled with these growths, rendering it almost like a straw. And you try exercising while breathing through a straw, you understand very quickly why he got so tired so easily.
As his trachea filled with the lesions, each strange breath triggered an intense cough that left Cody spitting up blood, and the growths as well.
A brisk cough that he may have had caused the papilloma to literally rip away from its anchor and have the bleeding right afterwards.
As the family struggles to grasp everything they're hearing, Dr. Koltai drops another bombshell. In a small number of patients, the HPV virus can trigger malignant growths.
My stomach dropped, my heart dropped, my everything just went, bah.
For the rest of Cody's life, we will have to keep an eye on it to see if and when it does turn into cancer. I don't know that I've ever been able to take a sigh of relief.
When you find out that someone you love has a really dangerous illness, it's very, very frightening.
Is this something that he can pass on through, sharing a drink with somebody or kissing?
I was actually really scared for Serena.
I was tested after we found out what he had, but I was not affected whatsoever. I was relieved to know that I was perfectly healthy.
I actually would have felt horrible if I had given it to her. Really not good.
Majority of people who are exposed to human papillomavirus never get recurrent respiratory papillomatosis. It seems to be something within the immunologic makeup of those individuals that results in the growth of these papilloma.
In fact, the chance that he could pass the disease to someone else is close to 0%. But unfortunately for Cody, there's no cure for RRP. While surgeries can clear his airway, the growths will inevitably come back. He must have an operation every 3 months to keep his trachea free of growths.
It's the natural history of this particular disease that it regrows, just like crabgrass in your lawn.
It's really frustrating, but now it's a way of life for me. I know I can live through it.
While the family is thrilled that the treatment will keep Cody breathing, they can't help but wonder why it took so long to land the correct diagnosis.
I think the unusual presentation delayed the diagnosis. It's a rare disease. There's about 6,000 cases active in the United States right now.
Today, Cody is facing life with vigor.
I liked the feeling of being able to breathe again. I'm really happy.
While he will still need to undergo regular surgeries to remove the growths, his life is much like any other teen's.
Mike, Cody, just graduated high school. All A's and B's. Very proud. He gets up every day and fights.
I'm proud of how he's handled this whole thing. He's always been a trooper, and he's my little hero.
I want Cody to know that he's gonna get through all this. I admire that he is so strong of a person.
I'm able to do pretty much whatever I want. I ride bikes. I don't run as much anymore, but I could if I wanted to. I feel like I'm pretty normal. If there's anybody else out there who's experiencing what I'm going through, don't give up hope, because there's always hope out there.